afternoon. My name is LaCorey Meadows. I'm a member of the CMC Board of Trustees, as well as the Director of OSU Extension Franklin County. It is such a pleasure to see everyone today. Today's forum, Purpose-Built Communities, is brought to us with support from the Ohio State University Wexner Medical Center, represented today by many friends and associates. Won't you please help me thank them for their sponsorship? Revitalizing communities and breaking the cycle of intergenerational poverty is a serious undertaking. Changing neighborhoods and changing lives is the mission of Purpose-Built Communities. Here in Columbus, Partners Achieving Community Transformation, or PACT, is a Purpose-Built Community Network member. Both are doing heavy lifting when it comes to transformation and change, so let's hear the details from our wonderful speakers today. Please join me in welcoming Elizabeth Seeley, Executive Director of OSU University Hospital East, Tei Street, Education Director of PACT, Trudy Bartley, Executive Director of PACT, Jerry Revish, News Anchor of WBNS 10 TV, and joining us from Atlanta, the President of Purpose-Built Communities, Carol Naughton. Carol will be making opening remarks, and Jerry will lead the conversation. Carol, the podium is yours.
Good afternoon, everybody. Thank you very much for inviting me to Columbus and asking me to be part of this very important discussion. As you heard, I serve as the president of Purpose-Built Communities. We are a nonprofit, pro bono consulting group whose sole mission is to help local leaders break the cycle of intergenerational poverty in urban America. Most people are not aware that poverty and place are deeply entwined in America. Let me paint the picture for you. 51 years after President Johnson declared a war on poverty, we have won some battles, but we have not yet won the war. 20 million Americans live in poverty. That's 1 in 10 Americans. More than half of those Americans, an estimated 12.4 million people, live in 4,000 census tracts that have been devastated by concentrated poverty. This represents a stunning 72% increase in the population of high poverty neighborhoods since the 2000 census. Trapped in a vicious cycle of poor schools, substandard housing, and unemployment, families in these neighborhoods don't have a clear path to the American dream. Concentrated poverty hits kids particularly hard. Half of all low-income kids live in neighborhoods of concentrated poverty. And if you live in a neighborhood of concentrated poverty, your road to hoe is simply harder than if you happen to be a poor kid in a more economically secure community. 86% of kids who live in concentrated poverty cannot read at grade level in 3rd grade. That's 6 out of 7 kids who live in neighborhoods of concentrated poverty can't read at grade level by 3rd grade. Now, that's a particularly important metric because it predicts in an extraordinarily accurate way whether a child is likely to graduate from high school, what that child's economic future is likely to be, and it also predicts what their health outcomes are likely to be. Zip code has become the most important predictor of life expectancy in our country. In New Orleans, where Purpose-Built supports a wonderful team working to revitalize a neighborhood in Gentilly, there's a 30-year difference in life expectancy between neighborhoods just 3 miles apart. I think you heard here at the Metropolitan Club last year that in neighborhoods in Franklin County, there's a 20-year life expectancy difference. And according to scientists like Jack Shonkoff at Harvard, the stress of living in concentrated poverty is a big part of the reason that those gaps exist. Physically, the stress of living in concentrated poverty impacts brain development in children as well as the developments of the rest of one's body. Now, let me be clear. The effects of toxic stress can be overcome with carefully crafted interventions, but the financial costs are high and the outcomes are much less certain. It's much smarter and more cost-effective to go upstream and reduce the toxic stress in childhood to improve outcomes later in life. So if the social justice aspects of this work don't resonate with you, let me share some economic facts that I think will. The U.S. loses about $500 billion every single year associated with childhood poverty. 500 billion, poof, it's gone. Next year, poof, it's gone. That's year in, year out. When Social Security started back in the 1930s, there were 150 workers for every recipient of Social Security. Today, there are 2.9 workers for every recipient of Social Security. When I retire in 2030, there will be 2 workers for every recipient of Social Security, and 50% of those workers will be Black or brown. And while 2030 seems like a long time away, it's not. The adults who will be in our workforce in 2030 are in elementary school today. These are the kids that we need to be serving really well because they are our workforce for those of us of a certain age who hope to retire someday. To be economically viable and maintain our standard of living, our country needs everyone to be prepared to be a successful worker in a knowledge-based economy, including children who today live in neighborhoods of concentrated poverty. Now, where you live, you may not see the impacts of concentrated poverty on a day-to-day basis, but let me assure you, we are all in this boat together. It's up to all of us to find pathways forward so everyone can be a successful participant in our economy. None of us are isolated from the impacts of concentrated poverty on our society. So I can hear I've created a pretty bleak picture. But hope is not lost. There is a pathway forward. And in fact, there are many pathways forward. And I want to talk about one in particular today. So Purpose-Built Communities has looked at all this data around the country, and we've estimated that within those 4,000 census tracts, that's about 825 neighborhoods of about 15,000 people each. 825, that's doable. If you average it around the country, it's 16.5 neighborhoods in every state. Now, obviously, the average isn't the right way to figure it out, but if you think about a state like Ohio, a mature state with a mature economy and a high population, my back-of-the-envelope calculation tells me that there's about 25 neighborhoods like this across the state. That, again, is doable. Purpose-Built offers one way to approach revitalizing neighborhoods to create deep, broad, and durable pathways out of poverty for low-income families while creating sustainable neighborhoods that serve everyone beautifully. Our model for neighborhood revitalization comes from our experience in the Eastlake neighborhood of Atlanta, as improved on what we've learned and, in fact, stolen from other really smart people around the country over the last 6 years. Now, I've been working on this revitalization in Atlanta for 21 years. I was a child when I started that work. But I say this to tell you that when you're thinking about creating a platform that will lift families up and out of poverty and breaking the cycle of intergenerational poverty, it doesn't happen in a 3-year grant cycle. It's long-term, sustained work that requires incredible intentionality. So let me tell you about Atlanta just briefly. So what was once the highest crime neighborhood in Atlanta is now one of the very safest. Distressed public housing has been replaced with high-quality mixed-income housing with deep affordability built permanently in. So as the neighborhood has improved, there's been a great place for low-income families to continue to be able to live. Children in the neighborhood go to one of the highest-performing schools in the city, a mixed-income school that serves more low-income kids than any other school in Atlanta, and where those low-income kids outperform the non-low-income kids around the city and the state, where the boys perform every bit as good as the girls, where public housing residents' incomes are 5 times higher than when they started 20 years ago, where everyone works unless they're elderly or disabled, a neighborhood where both the human capital and the real estate revitalizations are sustained by excellent education. So our holistic neighborhood revitalization model has 3 key elements to it: high-quality mixed-income housing, a cradle through college education pipeline, and the kind of health and wellness programs and facilities that help everyone meet their full potential. But the secret sauce to our approach is in the magic of what we call a community quarterback, a newly created nonprofit whose only reason for existence is to make sure that this complex, cross-sectoral, long-term work is accomplished with excellence and accountability. Community quarterback organizations have boards made up of civic and business leaders who are willing to use their relationships, their chits, and their access to capital to help move the initiative forward. Community quarterbacks typically hire a very small staff of high-quality individuals who manage the initiative going forward. Now, I have to tell you, this sounds really simple, but it's not. It's incredibly hard work, but it makes a difference. Purpose Built is now supporting 15 neighborhood initiatives around the country, and we're vetting 40 more, including some others here in Ohio. It's really, really hard work, as I've mentioned. For Purpose Built, I was in 11 cities last month. I'm tired. But as tired as I am, the hard work is what happens locally. It's what local leaders do to create the infrastructure that allows families to reach their full potential. And frankly, nobody across the country is doing a better job at this than PACT, Partners Achieving Community Transformation. Formed by the city, the Ohio State University, and the Columbus Metropolitan Housing Authority, PACT serves as the community quarterback on the Near East Side. Their work over the past few years led to the creation of the Blueprint for Change in the Near East Side, which led to a $30 million investment from the federal government through the U.S. Department of Housing and Urban Development's Choice Neighborhoods program. PACT is leading this work, connecting deeply with residents who live in the Near East Side and making sure that all of the partners are implementing with excellence. I can't stress how important that is. So many times when people are working in low-income neighborhoods, there's kind of a good enough attitude. I will challenge you that good enough is not good enough for kids who aren't going to get a second chance, for neighborhoods who aren't going to get a second chance. This sense of excellence and high expectations is fundamental to the role of the community quarterback. PACT is an intersector, one of my favorite wonky words. They are at the nexus of public, private, and nonprofit sectors. And because the leadership understands how all of these sectors work, they're in a position to help make sure they can all work together effectively. So I could talk about PACT all afternoon, but I will not. I'd like to sit down and open the conversation to the real experts, the folks on the ground who are doing this work every day. Thank you.
Thank you, Carol, for that great overview of what you're doing across the country. Give her another round of applause. It's really great. 11 cities, big tour there. Columbus is nothing without its neighborhoods, and each one of them have a different personality and a different flavor to them, and that's what makes Columbus just this rich gumbo, if I could use that term, of diversity around the city. So we want to talk about some of the things, particularly the work of PACT this afternoon, and we're going to be opening up the floor for some questions a little later. Our first question is going to be to Trudy Bartley today, the Executive Director at PACT. What makes PACT's model of community transformation different from other revitalization efforts we have going on here in Columbus?
Jerry, thank you, and Carol, thank you for that wonderful applause for what we're doing at PACT. As she said, it is hard work, but it's work that we do with a passion. Before I go forward as far as where we are, I think we need to understand where we came from, particularly on the Near East Side. The Near East Side, the PACT geography is 800 acres. The boundaries of those acres are 670 to the north, Broad Street to the south, 71 to the west, and Woodland Avenue to the east. 800 acres in comparison to downtown, which is 950 acres. That is a large swath of land. It was in the 40s and 50s an area that was a known African-American community, very socioeconomically diverse. You had You had cultural activities happening around the King Lincoln area. You had Cab Calloway. You had Lady Day. You had what was known as, for African Americans, the Chitlin Circuit that would come through to the Lincoln Theater. You had grocery stores on Greenway. There was a Sohio on Long and Ohio. There was access to to Franklin Park. Franklin Park was the place where African Americans convened. It was a great community, and it was a community where I was raised. I lived across from Franklin Park. I listened to the East High Marching Band when I woke up in the morning. My dad took me to Ohio Day Nursery on Ohio Avenue. He had a dentist's office on Mount Vernon. There were bars, there was commerce on Long Street and Mount Vernon. It was the African American Mecca for Columbus, Ohio. Then there came a freeway, and the freeway cut the city off, or the neighborhood off, from downtown. Then you had fair housing laws, where individuals who had the opportunity to leave and go elsewhere and to integrate into other neighborhoods did. We started with, let's say in the 40s and 50s, a population of about 50,000. Today, we have a population of 7,700. And that has happened over a 40-year period. So it's looking at not where we were and becoming that again. It's looking at what we can become, understanding the demographics, understanding where our adults are, understanding where our children are, understanding what the workforce development issues are, what the safety and health and wellness issues are. And that's what PACT does. We are the community quarterback that went to the neighborhoods and asked the residents, what are your aspirational goals? We had lessons learned from Nationwide Children's. We had lessons learned from Wyland Park. And we said, let's look at the best practices and let's look at some of the things that didn't work out so well. And let's talk to folks in their homes, at coffee shops, and find out exactly what their priorities are for their neighborhood. And from there came 5 focus areas: education, housing, health and wellness, safety, and workforce development. Now, many times in community development, you will see everyone doing something one by one. We use a holistic approach because we think that you've got to do it all together in order to make a difference. It's got to be place-based. But the one thing we do know with PACT, looking at what the information that we gathered, that education is the key to keeping people in the neighborhood and bringing people to the neighborhood. We looked at our schools, we talked to purpose-built communities, and we said we want to focus on the 7 schools in our feeder pattern and make them great. And we partnered with the help of Dr. Gabby to look at putting together the Health Science Academies. And the Health Science Academies, which Tei Street, who's Director of Education, will discuss, are 7 schools, 5 elementary schools, 1 middle school, and 1 high school. And what we've done is that we've created curriculum, we've created applicability, and we've created a family university that really looks holistically as far as how do we assist the families, being not teaching them how to parent, but how to be advocates for their youth, looking at the curriculum and really kind of putting it together with a health science focus and a thematic, not saying that everyone will go to allied medical health, but be prepared for whatever type of opportunity that comes before them. And then also putting together that family component. So therefore, we have everyone working together for the best interest of our youth. For housing more so, we are not a housing expert. We are a nonprofit, and we stay in our lane. We bring the resources and the expertise to bear for those programs, initiatives, and projects that are outlined in the community, in the investment for community development. So, as I said, we have Don Tyler Lee, who I believe may be here today, who was our initial executive director, who put together the engagement and planning component. We took that information, worked with Ohio State University, Columbus Metropolitan Housing Authority, and we were granted a Choice Neighborhood Planning Grant. We were able to take the information that we gathered from the residents, and we were able to do a deeper dive. And that Choice Neighborhood Planning Grant resulted in our grant for community investment. And then from there, Columbus Metropolitan Housing Authority was able to take that master plan, apply for a Choice Neighborhood Implementation Grant, and they received $30 million. So it's great to go slow to move fast. Don't try to do everything at one time. Be planful and purposeful, because you're affecting people's lives. And it's not about you. It's about how do you transform a neighborhood that at one time was on top of its heyday, and then help them with resources and partnerships and investment to create a new heyday for the families and the residents that reside there.
Thank you, Trudy. Appreciate that overview and all of that. Round of applause. Thank you. Good to hear about the roots of the East Side. Elizabeth Seeley's the executive director of the OSU University Hospital East, the old St. Anthony Hospital there on Taylor. Ohio State University has a strong presence on the Near East Side with the hospital. What do you see as the role of the hospital there and also as a community partner there?
Absolutely. I see those roles as really being intertwined. So when you look at the Ohio State University and the Wexner Medical Center and the hospital all working together in collaboration with PACT, if you think about the university and its land grant mission, that comes to play with our efforts in PACT. We have a commitment and an obligation and a responsibility to improve our communities. The medical center has a mission and a vision of improving people's lives. And so with PACT, all of those things come together. You mentioned the long history. There's actually been a hospital on the site since 1891. An anchor in the community, and for the past 17 years, the hospital has been part of the Wexner Medical Center. And so we were very excited when the PACT initiative got off the ground and started realizing just the tremendous impact that it could have. And as we think about the evolution of healthcare and where that's going in the country, moving away from historically, collectively, we've treated illness, moving toward treating health status and helping people lead healthier lives. Health just isn't about receiving care. It is about the neighborhood that you live in and the statistics that Carol shared and the interplay between the social determinants of health and housing and job opportunities and education. All of those things fit together. But clearly we do have a role in healthcare, and so one of the things that we've done that's been evolving is the purchase of the outpatient facility at the corner of Taylor and Leonard Avenue. So we're not just a hospital, we're actually also an outpatient place where as primary care and preventive care becomes more and more important to improving health status, we provide access to that. You may have been here last month to hear the leaders of the health systems in Columbus talk about the Franklin County Health Map 2016 and the needs that we have in this community, and access to primary care is one of those needs. So at our outpatient facility, we have family medicine, we have general internal medicine providing that access to care. Chronic care is another need. We have people in our neighborhood that are suffering from diabetes, from heart disease, from any number of chronic conditions. And now at our outpatient location, we're providing access to specialists to treat those conditions. For our patients in our diabetes program, we have a garden on the roof of the building where they're growing food and then working with the nutritionist to learn how to utilize that food to have healthier lifestyle choices. The other thing that we're doing is, obviously, as a university, we're training the future of health professionals. So, for instance, physicians that may want to practice in an urban setting, through our Department of Internal Medicine, we have an urban residency training track where those individuals can learn and discover how to practice in that urban setting. Our College of Nursing with the university has set up a nurse practitioner-based total health and wellness clinic that not only provides primary care, but in the hospital also coordinates with mental health services and with pharmacy and nutrition, all those things coming together, which is truly an innovative model. So we're working hard to deliver those services that are needed, and a number of them, were discussed in the needs of the community, not only through PACT, but also through this planning effort related to meeting health needs. But beyond that, what I see the hospital and our resources is provides a physical place. So for instance, Dr. Pat Gabby, who's here today, the leader of the Moms to Be program, we provide an opportunity for mothers to come and receive education and support and a nice meal. And meanwhile, we have the physical space for the Mid-Ohio Food Bank to bring a truck with fresh produce for the moms to take home. Or we have the dental van that can come for preventive services, or Nationwide Children's with their preventive services so the kids can get their immunizations. So all those things we provide a space for. The College of Nursing, training community healthcare workers, reaching out into neighborhoods through Celebrate One to have a better impact on infant mortality, another significant health need. So, and then finally, I wouldn't be remiss, and I'm not going to steal T's thunder, but our Health Sciences Academy that you heard Trudy mention, our healthcare professionals across the hospital and the Wexner Medical Center are so excited to be part of this initiative, whether that's participating in white coat ceremonies with the kids when they get their white coat, or clapping in the students when they come back to school, or providing a guest lecture as part of the curriculum, or going to a health career fair where students can learn about all the different choices, everything from clinical engineering to a sleep lab technician, careers above and beyond what you might traditionally think of in terms of healthcare opportunities. So there are just so many ways that this all comes together, and that's what makes our work with PACT so exciting, and our role as a hospital, as a medical center, and a university, holistically addressing these things and not just trying to deal with the issues one at a time, whether it's housing or education, not trying to deal with it in silos, but across these partnerships and collaborations.
Great. Thanks so much for that. I appreciate that very much. Elizabeth Seeley. T. Street is the education director at PAC, and talk to us, T, about the focus on education and why that's such an important component of what you're doing.
So education is an important component of everything that impacts our civilization. We know that families won't move into neighborhoods where their schools are not high performing. We learned through the process, and I would be remiss if I didn't tell you, that I just get to be the quarterback for the coaches, my colleague Autumn Glover and the education subcommittee that went out and asked the community what they wanted. They became the coaches. I'm a football fan, so they became the coaches who devised the plan for the Near East Side, for what I then got to come along as the quarterback and simply carry out the plan. And I try not to deviate too often from the coaches' plans. And so, Autumn, I thank you for the groundbreaking work that you did with those committees early on to make sure that we came in and inherited something that we could build on. And our work continues because of the work that you laid the foundation for. So thank you very much. A part of what the community told us is that they didn't have the will to do a charter school. So for all the charter school proponents, I'm not anti-charter school, but I am a proponent of doing what communities find best for their community. And so based on what they told us they wanted, we knew that we had to roll up our sleeves and come to the table with our public school district, which is Columbus City Schools. It was about a 1.5-year process of talking back and forth about what our needs were, where we wanted to go, that we needed innovation that the district had not yet done, that we needed some folks who were dedicated specifically to these 7 schools. And after about a 1.5 years, we came together with the help of Purpose Built, drafted an MOU that I think is really an example of how communities, how nonprofits and corporations can come together with public school districts to really make an impact. And so we have an MOU that was 100% approved by the Columbus Board of Education, and we're very proud of that. Early on, people told us that the district didn't know how to do good partnerships. Well, I'm here to dispel that myth. I'm so grateful to our partners who are here from Columbus City Schools who have rolled up their sleeves, and we are doing groundbreaking work. But I will tell you, our schools didn't get into the shape that they're in overnight, and they won't be fixed overnight. So when people say, well, what are the outcomes? We just launched in August of 2015. The phrase that Trudy used earlier was actually coined by my colleague from Columbus City Schools who's here, Rodney Harrelson. He said, T, in this approach to education, we're going to go slow to go fast, because we've seen what happens when people come in and sort of dump programming in. And we're going to take our time and we're going to build it, and we're going to make mistakes and we're going to learn from that. We're not going to give the schools one more thing to do. We're going to do transformative schools while simultaneously adding this thematic approach called health sciences that really is a workforce readiness program for our future. And so we've been working on that with three sides to the equation. I'm a Delta, so I like pyramids. We're going to provide students with, we're going to provide students on this side, we're going to provide students on this side with aligned curricular experiences. We've got a team of folks who work on nothing in Columbus City Schools but the curriculum for transformative schools, yes, using the Common Core, but also adding in the concept of health sciences across. So they're not just going to be studying health when they're thinking about science or when they're thinking about health class. They're going to be looking at health sciences and math, health sciences and reading, to really make this a comprehensive approach. And on this side of the triangle, we're going to link them to real-world experiences. This year, we got a grant from Franklin County Job and Family Services to partner with COSI to do some aligned experiences where our kids could really go and do science. Our kids are kinesthetic learners. They learn by doing, not always coming from books. And we've got to move away from the model that says we're only going to teach children of color and low-income children out of books, because the research tells us clearly that that's not their dominant way of learning. And so we partnered with COSI and had our kids at COSI and had COSI on wheels, something these 7 schools had never experienced. And so we're grateful for our partnership there. But we also know that we've got lots of work to do to remove the non-academic barriers to learning. We know that our kids show up sometimes not ready. And so we're doing things as best we can to engage families. We have Family University next Saturday, July 30th, 9 a.m. to 3 p.m. It's free to any parent and family of Columbus City Schools. So promote that, if you will. Last year we had Parent University. It was immensely helpful. We had a parent who was sitting through the social and emotional readiness workshop, and she had 6 children. And she started to cry. And as Cheryl Ward was facilitating, from Columbus City Schools, was facilitating this workshop, I turned around to the mom and I said, what's wrong? Because we've been together at this point a number of hours. And I said, what's wrong? And she said, I get it. The teachers always say that my children speak so angrily. It's because that's how I talk to them. I've got to change. That sent chills up. It's one thing to recognize that that's what you do. It's another thing to recognize that a change is necessary. So we're doing some things to impact families as well. We're bringing communities into our schools. And so for all the critics who always have something to say, what I tell them is, I have great respect for people who are umbrella manufacturers, far more than for folks who are meteorologists. Anybody can tell me it's raining. Do you have the will to roll up your sleeves and provide an umbrella for our children?
Thank you, T. Really enjoying this conversation from all of you. Carol, when you go into these communities and think about how you're going to help them, what have you found over the years that does not work? Techniques that we just have found, hey, we're not going to try this to make this work.
Great question. So first we go where we're invited.
Okay.
So that's, where have you been invited? Let's start there. And then the next thing is I think nobody's done this better than the folks here at PACT, but to listen. When we're first invited into a community, to listen and learn about both the assets and the challenges in a community. And rather than sitting in, an office building someplace and saying, oh, here's exactly what you have to do, we have a model, but it's highly customized, or highly customizable, if that's a word, to react to what the needs of a particular community are. So I think if you go in and say, hi, I'm from Atlanta, I'm here to help, that doesn't get the right kind of response. But when you engage community, engage leaders, and listen and learn, then you can build authentic relationships, and that's the start of moving a project forward fast.
You finding a little skepticism when you come in there? I mean, some of these neighborhoods, not only the one we're talking about here, but across the country, have had sort of helping hands parachute into their neighborhood, offering help, but then they got burnt by broken promises.
Yeah, another great question. And that was certainly our experience in Eastlake, and Eastlake's not any different than other struggling neighborhoods. When we first started, I started working in Eastlake in 1995 when I went to work for the Atlanta Housing Authority as the deal lawyer, who was supposed to put the legal and financial model to do mixed income housing together. And our organization was really broken. And that was the great thing for me, because it was like being at a startup. If you demonstrate the least little bit of talent and enthusiasm, you got to do things that were not part of your job description. And that happened to me. And so I was invited very quickly to become part of the planning committee for the Eastlake revitalization. And going out into the Eastlake neighborhood and meeting Eva Davis, who is the president of the Eastlake Meadows Tenants Association, who had been the president for 40 years, the only president. She was the gatekeeper. And Ms. Davis had been burned by a lot of folks, people who'd come in before and said, hi, I'm from this church and I'm here to help, or I'm here from this government agency and I'm here to help. And so when the Housing Authority and its partners, including the Eastlake Foundation, showed up and said, hi, we're here, we'd like to work with you on this, it was like, oh yeah, sure you are. And because the Eastlake Foundations was created by a rich white real estate developer from Buckhead, everybody believed that he and his family were into some kind of real estate grab. In fact, I didn't believe Tom Cousins for the first 3 years I worked on the deal. It took me a long time to actually believe that he was doing this just because it needed to be done. It was the right thing to do. So it's, again, that authentic trust building, coming out and getting to know folks, meeting them where they are. My biggest mistake when I went out to the community first is I tried to treat the community like they were a corporate real estate client. So, you know, if you're a corporate lawyer, like I was, you know, you put on your armor and you go into a client meeting and you have all of the answers, right? You don't ever want to look like you don't know anything. That's totally the wrong approach to get to build relationships in the community. So I had to get hit upside the head a few times to understand that by making myself vulnerable and letting people see that I didn't have all the answers and that I was struggling with many of the same issues that they were as a young working mother and all those kinds of things, that helped me build relationships in a way that I never was prepared to based on my experience as a corporate lawyer.
Thank you. Trudy, let me ask you this question as we get ready to take some questions from the audience. The mixed income housing component of all this, how well is that working, or what needs to be yet done?
With the mixed income housing component, that really is a CMHA through the Choice Neighborhood Implementation grant. And at this point in time, you may go down Champion Avenue and you'll see 100 new units of senior housing on Champion. And that is miraculous. When you think about what was there, which had such history and heritage for the Near East Side, but what you all see right now is a place for seniors to live and to go across the street to the Intergenerational Center for programming. It is just, it's a delight to see that there is starting to be that revitalization and that vibrancy in the neighborhood. With CMHA and Poindexter, that was 26 acres. There are 2 buildings that are currently left that are looking to be repurposed moving forward. However, there will be 449 new units on that space. And they will be mixed income, and CMHA is using a little bit of the formula that Purpose Built did for Eastlake, looking at a third and a third and a third, a third low, a third moderate, and a third market rate. Because you want to have a mixed income community, much like the Near East Side was, where people see and model after other people what they see. They model seeing people go to work. You model seeing students go to school. You want to really capture that and invest in that to move it forward. We are also looking at we have an MOU with the Franklin County Land Bank and the City Land Bank, And we're working with them, particularly on Ohio Avenue, which really is adjacent to Poindexter, and looking at mixed income housing there. But what we're also seeing, particularly along Long Street, which is an area that former Mayor Coleman had really worked on, particularly with the Lincoln Theater and the Whitney, we're seeing rents now that are going for $1,200 to $1,800 a month. That is phenomenal. These were areas that were vacant and abandoned. But with this blueprint and with this master plan and with these strategic corridors that have been identified for commercial revitalization, for housing revitalization, there are small to mid-sized developers who are coming to us and saying, we want to be a part of this plan. We want to be a part of your strategy. We want to understand exactly what your design standards are, because we want to be a part of this because we think this is going to be successful. So again, it took a long time for it to get where it is right now, and it's going to take more than 5 years to even get it out of where it is currently. But with time and good people who are passionate about the work, looking at not only housing, but looking at the education, looking at the workforce development for the adults, looking at safety and health and wellness, we will get there.
Thank you so much. It is a CMC tradition to take audience questions, and that's where we are now. The mic is right here in the front part of the room. Please state your name as you come up, ask your question, and we will thank you in advance for not making long editorial comments, okay? So let's proceed with our first question.
Thank you very much, and thank you, panelists. I'm Jim Coe with WCBE NPR Radio. I live in the neighborhood, and I'm not trying to put Trudy on the spot at all, but I am mildly curious. What's the plan? And I understand the 5-year and 10-year aspects of it, but what's the plan with Taylor Avenue?
Taylor Avenue.
Or for people that don't live there, the gateway to the Near East Side.
It is a gateway.
Coming off 670.
Exactly. It's a gateway to the Near East Side. It's the gateway to two of our major assets in the area, that being Point East and OSU Hospital East. When you drive down if you drive down Taylor Avenue at this point in time, you will see vacancy and abandonment and blight. You will see gates around houses that are about to fall down. And as I said before, we are currently working with the City Land Bank. Anything that was in the land bank within that 800 geography goes to PACT first. We do have developers who have called the land bank and have asked, and we talk to them, to tell us exactly what our plans are for the future. As I said, those individuals were looking for, what are your design standards, what are your plan, because we want to be a part of that. They don't want to be the outlier. They want to be a part of revitalization, because when you look at where the geography is, we are a gem. We are between Bexley and downtown. We are right down Broad Street. Long Street goes right through our geography, and then there's 670. So there are other neighborhoods that are being revitalized, but when you look at the walkability, particularly with the cultural wall now, between the Near East Side and downtown, when you look at the schools that are just right across the bridge, and you're looking at housing for students, we're right across the bridge, and we're affordable. We're affordable now. But what we're trying to do is keep people where they are and also bring new individuals in. So it's not about gentrification. It's about having a balance of keeping the neighborhood whole.
Now, acknowledging what you said about the decrease in population over the last 60 years, and realizing that we need a grocer in the neighborhood, from your conversations with grocers, what do they need to have as far as number of rooftops before they're going to make that investment in a community?
Of course, everyone knows that there's a formula for groceries, looking at disposable income, looking at rooftops. 7,700, not looking at us right now, even to the point of a Save-A-Lot or an Aldi's, which we don't necessarily want in the neighborhood, but they are really kind of skittish about looking at us as well. We've got to look at what's happening with CMHA, with Poindexter. We've got to look at what we're doing along Taylor Avenue. But there are also tipping point areas within the geography that are going to take care of themselves. And those are those beautiful homes that you see between Broad Street and Long Street, and they're the homes between Woodland and Taylor. People are coming up and they're buying them and they're renting them or they're living in them. So as I said, it's not necessarily, we are a spark for the investment to bring in private dollars, to look at and to say that this is a great neighborhood that they want to be a part of.
Thank you. Yes, ma'am.
Hi, Barbara Poppy. And I have a question for Carol, but I want to say it builds off of Trudy's statement, which is the intention is not to have displacement and have this be a mixed income community because the original residents get to continue to reside in it. My question for Carol, though, is that oftentimes the reason the scores go up in the schools, the reason you get to greater economic diversity is, in fact, the original tenants get displaced. So what I'd be interested in, what is purpose-built seen in all these communities that you're working in are the strategies that make displacement not occur and give false indicators of success in a neighborhood simply by moving out the folks who have the very lowest incomes?
So, great question. And first I want to just comment in Eastlake, our school did not become a mixed income school until the school, which was then about 99% African American and about 90% free and reduced lunch, was the highest performing school in Atlanta. Then the white kids came, then the kids with more economic juice came, and that's great. We're thrilled to have a more economically diverse school and community because we think everybody will be better served. So the way I think about relocation and choice and competition in this work has really evolved over the last few years. You know, when we first started, everybody wanted to know, well, how many people came back and where did people go? And well, I've got all those statistics, and we've worked with economists to understand what's happened with people. But now the reality is, if you've been living in, let's say, public housing that has not served your family well, people in Atlanta and many cities, they're desperate for a Section 8 voucher. Give them a Section 8 voucher. People want the voucher and they want to choose where they get to live, right? And the voucher programs are always highly sought after. So what I want to do, I want to compete for people to stay. I want to make it a rational choice for people to stay in the community rather than to make the smart thing to take the money and run, you know? So that's what we think about it now, is how do we make sure that we are offering to everybody who lives in a community a really good reason to stay, because it'll be a great place for you and your family. When we first started in Eastlake, the smart money was to leave because this had never been done before. And so people took those vouchers and they couldn't wait to get out of Dodge. What we try to do now is think about, as we communicate with communities, how do we compete for you? What do we have to deliver for you, madam or sir, to make this a great place for you to want to plant your flag and say, I am in. So, and most of the places we work with are not unlike the Near East Side, where there's been huge disinvestment over time and a huge migration of population outward. So part of it is you want the people who are there to stay and to feel like they're smart and on top of things because they've stayed, but you also want to attract other folks in. And I would say as you do that, you want to plan to win. And when I say that, it means, so I'll tell Trudy, buy more land than you think you're ever going to need. Because unless you control the land, you can't control for permanent affordability down the road.
But I have to address this issue because there's an embedded bias in that question that the children who are in these schools are not already intelligent and that we have to import people in order for our children to do well. Until 4 months ago, for the last 10 years, the Near East Side is my neighborhood on Garfield Avenue. When you go into these 7 schools, East High School, Champion Middle School, and by the way, 3 years ago, Champion had 210 kids. This year we had 459 kids. And when you start to look at some of the indicators that are changing, discipline is down by 75% in 1 year at Champion. They had 472 incidents compared to over 1,000 last year. So I refuse to believe that children who are already in this neighborhood are not capable of learning. And if you doubt it, I want you to walk through Champion. I want you to walk through, and by the way, 2 of my principals are here. The new principal at Trevitt Elementary School. Can you wave your hand, Dr. Mason? I want you to raise your hand, India Wilson, who's a new principal at Eastgate Elementary School. If you've not been to the new Ohio Avenue Elementary School where that principal is doing some amazing work, you're missing out. If you've not walked into Beatty Park, if you've not walked into the schools of the Near East Side, I really challenge you. And the only way that our schools are going to change is that we have a belief system. Alicia Gillison, who is the chief academic officer for the district, she spends a great amount of her time talking about closing the belief gap. Not the achievement gap, the belief gap. Our kids know now that they have partners in this community, the city of Columbus, Metropolitan Housing, who is rolling up their sleeves and making sure that there is a connection between home and school and PACT, and we're all doing it together. But I challenge the assumption that poor children and kids of color cannot learn. And so we don't have to import people to get academic excellence for children.
Thank you, T.
Fred Needham. And along with the criteria we have with the education and the development with the housing and so on, then a critical factor becomes the employment, because you have to have jobs. You're talking about how the neighborhoods were cut off with the freeways, and so that made it difficult to. So we have both the employment and then the support factor of that is the transportation to go along with it.
So I'm going to take this one because I think it's one of the true assets that the university and the medical center has right in the community with University Hospital East and our outpatient facility, employing 1,100 individuals by the hospital alone, and then all of the services at CarePoint East on top of that. So, but what we need is a qualified pipeline of individuals coming into those job opportunities. And that's really the beauty of the health sciences academies is it's not going to be immediate, someone graduating high school, but showing the opportunities that are available. We need people who meet the criteria that those jobs, they're great jobs that offer, and we have a full spectrum of mixed income jobs across the medical center and across the hospital and in the outpatient setting. And so providing the inspiration, but then providing not only the inspiration, but here's how we're going to get you there through meeting these standards so that people are qualified to go on to further education and have that opportunity to then advance into those job opportunities, because as a major employer, we're there. The PACT blueprint also includes opportunities for additional commercial development. So as things start to build, as the people come, and it's all tied together between the education, housing, you want to live somewhere where there's good education, and then having the mass of people to then have small businesses come in to serve the population, whether it's grocery or other opportunities, services and goods that people need. That's where it all starts to build upon itself, like a snowball going down the hill.
I just love it when we run out of time because there are so many other things we could touch on today. Give our panel a round of applause. Beautiful job. We appreciate all of you. Back into the hands of LaCorey Meadows.
What an amazing conversation, but more importantly, what exemplary work. As a young person who grew up in a community that was disinvested in, I want to just say thank you. Thank you for your continued investment in what you do. I hope you all enjoyed today's forum. We encourage you to continue the conversation in the back of the room with coffee and cookies. You can view and share today's forum and all of our forums on CTV, Columbus Television, on WOSU and PBS affiliates statewide through the Ohio channel, and anytime on CMC's website via YouTube. Please thank our sponsors, the Ohio State University Wexner Medical Center. Thank you so much for sponsoring. As well as our wonderful speakers, Elizabeth Seeley, the amazing Tei Street. I like pyramids too, T. She's fire. Trudy Bartley, Jerry Revish, and our wonderful guest all the way from the city of Atlanta, Carol Naughton. And special thanks to all of you for being here. We look forward to seeing you at CMC again soon. Have a great afternoon.